Joining us. I'm Cassie Sauer, and I'm the CEO of the Washington State Hospital Association. And today, joining me are Susan Stacy, who is the Chief Executive of the Spokane Inland Northwest area of Providence, Dr. Michael Mint, who is a Physician Executive for Population Health at MultiCare Health System, Brenda Sharkey, who is a nurse and the Chief Nurse Executive at Ocean Beach Hospital in El Waco, and Mark Taylor, a fan favorite. Mark is one of the leaders of the Washington Medical Coordination Center and someone we work with very closely on moving patients around the state. So as always, I'll start with some opening remarks and then hand it over to our panelists, and we're happy to take questions throughout. You can put your questions in the chat, or at any time you're welcome to unmute yourself and ask your questions. So first, the current case rates. There are currently 2,333, last I looked. Mark might have more up-to-date numbers, but that's the last I had. Confirmed COVID cases in our Washington state hospitals, and then 147 more people who are in the hospital who are suspected to have COVID, but that's not yet been confirmed, like they've been tested and the test hasn't come back yet. And King County and Pierce County are the hardest hit counties, but it's really only a matter of time before other parts of our state are hit equally hard. But on the hopeful side, the number of new hospitalizations coming into our hospitals each day is down just a bit. So that's we're all crossing our fingers that is actually the beginning of a trend and not just a blip. The hospitalized COVID patients are a mix of people who are admitted because they are sick enough with COVID that they need hospital care for COVID, and also people who are admitted for something else who test positive for COVID when they're at the hospital. And sometimes that something else has no relationship to COVID, like they got in a car accident. And sometimes it's something else has either been caused or exacerbated by COVID, like a heart attack. But either way, the patient has COVID and requires increased staffing and PPE, which further strains the system. It's a really staggering number of cases. It's that, we're at a higher peak than we ever were with Delta, and it continues to limit our hospital's ability to care for patients who need help. And I'll ask each of our panelists to describe the kinds of care that they're delaying or denying. It's really heartbreaking. Another thing that we are seeing, which is not good news, is we're seeing a steady increase in ventilated patients. There are currently 145 people on ventilators compared to 135 the prior day. And as we said before, ventilated patients are hugely staff and PPE intensive. It takes a ton of work to care for a ventilated patient. And the survival rate for ventilated COVID patients is really not that good. So any increase in patients on ventilators is very bad news. And deaths are also climbing. Not too long ago, I think the last time that I was the host of this media briefing, I was reporting that we were seeing between 10 and 15 deaths a day, and that number is now between 30 and 35. And these are almost all unvaccinated and unboosted people. And you've heard me say before that this just floors me, that 30 or 35 people are losing their lives each day in our state to something that's mostly preventable is just stunningly tragic. And I just struggled to imagine the grief and the heartache that they leave behind. And these deaths, there's a lot about this pandemic that we could repair, but these deaths cannot be undone. So we'll talk today, given this really extreme strain on the hospital system, about the fact that the Washington Medical Coordination Center is having increasing challenges placing the very highest acuity patients. So these are patients that need care right away, or their risk of disability or death is huge. So consequently, the WMCC has asked the states what they call the state's resource hospitals. These are the large tertiary facilities to activate a guaranteed acceptance rotation protocol. So this is a system that's unique to our state, that was designed by the hospitals that are participating, that will save lives. The large hospitals set this up via the Hospital Association last fall, but we haven't had to use it until now. And so triggering this system is a major bellwether of where we are now with COVID and hospital capacity. Not a good bellwether. I'm going to talk about PPE. We are hearing concerns from our hospitals about whether there's adequate PPE to meet the governor's new proclamation that requires hospitals to use PPE according to conventional strategies. Some hospitals have been using PPE in a conservation mode. And it's especially true for N95 masks, which are being snapped up at higher rates by the general public and also the federal government right now. The supply chain is struggling, and it may not be adequate to allow hospitals to obtain enough PPE. And the governor has told us that the state has a PPE supply to support the needs of hospitals, but hospitals are struggling to get access to it. And so we are diligently working with the state to urge a faster and more responsive PPE distribution process. We at the Hospital Association are going to be purchasing 3M N95s directly from the mass manufacturer 3M, so we know they are real. We talked to you all about the problem of we and others in our state purchasing counterfeit 3Ms, and so we're glad to be buying them right from 3M. That order will go in tomorrow. It's only for a couple of models. The most popular 3M N95 models are still in really short supply. I'll talk a little bit about difficult to discharge. This is another strain on the system. We still have many, hundreds and hundreds of patients who have completed their medical care but can't leave the hospital. I just want to be really clear about this. This means that people with no medical needs are getting care, and others with severe medical needs are not getting care because of they are taking up the space. And the governor has pledged substantial help on this issue of difficult to discharge patients, sending staff to skilled nursing facilities so they can accept more patients, increasing the number of DSHS caseworkers who do the assessment process, which right now is very slow, contracting with the area agencies on aging to assist with non-Medicaid discharges, engaging more guardians and providing resources to expedite guardianship proceedings, continuing those incentives to skilled nursing facilities and home care agencies who admit people who are being transferred from hospitals. And we are really eager for this help to get rolling and make a difference in our hospitals. The last thing I want to talk about is staffing in our hospitals. I just want to be clear that we are not where we want to be with staffing. As we are acutely aware, there's a critical staffing shortage across the state and our nation in all sectors of not just the healthcare workforce, but all workforce. And like all industries, the number of staff who are diagnosed with COVID keeps rising. So this week, some of you might have seen that the first hearing on a staffing ratio bill was heard in the state legislature. And we absolutely agree that more needs to be done for the healthcare workforce, but we strongly disagree that this bill is the path. And just want to give a contrast to what we think is a much more effective response to this. New York just announced an ambitious plan to retain staff while building the healthcare workforce. They're investing $10 million over multiple years in the healthcare workforce. $4 billion of it goes to support current healthcare wages and bonuses. But it also really thinks about the healthcare workforce of the future and invests in workforce training and provides financial aid, stipends, and childcare for students. Washington State has chronically underfunded its healthcare workforce training programs. So this is the type of concrete investment we need in our healthcare workforce. And we have heard some people saying that Washington would have fared better in the pandemic if we had had staffing ratios in place prior to the pandemic. Just to remind you, only California has these comprehensive ratios. And California has absolutely not fared better than Washington State. In fact, it's been far worse there. Los Angeles, for example, experienced a tragedy of ambulances full of dying patients idling in their streets because hospitals could not take them in. This is not something that we want to experience here. We received countless calls from California hospitals desperate to place patients that could not be placed in their own state. And you in the media have undoubtedly seen these terrible headlines from California. They've had intense staffing challenges and they have not avoided patient care crisis with severe consequences for their residents. So this bill may seem like a solution, but it really is not. And what we think it will do is deepen the staffing crisis in other areas of the healthcare system as hospitals take up more of the workforce. And worst of all, it will undoubtedly lead our hospitals to delay or deny care to many who need it. So we remain firmly opposed to this bill.